In this COVID-19 safety training, we'll discuss the nature of the virus, how it spreads, and what we can all do to stay safe while at work. COVID-19 is a coronavirus, part of a common group of viruses that can cause diseases in mammals and birds. Coronavirus disease 2019, COVID-19, is a new virus which first emerged in people in 2019. COVID-19 affects your respiratory system. In some cases, it can cause problems with your lungs, such as pneumonia, where the lungs become infected and inflamed. COVID-19 affects people differently, but common signs of being sick are fever or a high temperature. This means you feel hot to touch on your chest or back. A new continuous cough. This means coughing a lot for more than an hour, or 3 or more coughing episodes over 24 hours. If you already have a cough, it may be worse than usual. A reduced sense of taste or smell. Other signs of infection may include trouble breathing, body aches, fatigue, headache, sore throat, runny nose. It's thought that a significant number of people infected with COVID-19 are what doctors call asymptomatic. This means they don't show any signs of being infected. However, they can still spread the disease to others. The virus is spread through droplets. When an infected person coughs or sneezes, they project virus-carrying droplets into the air around them. These may be inhaled by people nearby or land on a surface where the virus might survive for several days. If you breathe in virus-carrying droplets or touch the contaminated surface and then touch your eyes, nose or mouth, you might become infected with the virus. Your eyes, nose and mouth are all connected to your respiratory system and provide gateways for the virus to enter your body. Stay aware of this and avoid touching these if you can. If you need to sneeze or cough, catch it with a tissue and dispose of this safely. If you don't have a tissue, cough or sneeze into the crook of your elbow. You should cleanse your hands by washing or using sanitizer immediately after blowing your nose, coughing or sneezing. In order to manage the risk of COVID-19 in your workplace, your employer will have conducted a risk assessment. The aim of a risk assessment is to identify and evaluate the risks associated with an activity and to reduce the risk to the lowest reasonably practicable level by taking preventative measures. The risk assessment will have taken into account the specific health and safety policies and procedures which are applicable to your workplace. You or your colleagues may have been consulted by your employer as part of its COVID-19 workplace risk assessment. You should familiarize yourself with this before returning to work, and if you have any concerns, discuss them with your manager or employer. Social distancing is key to keeping COVID-19 under control. This is because one of the most common ways for the virus to spread is through direct person-to-person contact. You are at higher risk of being directly exposed to respiratory droplets when you're within 2 meters of someone and have face-to-face contact with them. You can lower the risk of infection if you stay side to side, rather than facing someone. Public Health England recommends trying to keep 2 meters away from people as a precaution. Realistically, this may not be possible 100% of the time. It is important to be aware that the risk of infection increases the closer you are to another person with the virus and the amount of time you spend in close contact with them. Think about this when you are in the presence of others. Imagine a sphere of air, with you in the center, your own personal biosphere. The region nearest you affects you the most, and you affect it the most. The more separation we can maintain between our personal biospheres, the more we protect ourselves and others. The key thing is avoid being close to others, and if you have to be close, make the time as short as you can. Where possible, you should try to keep to the same group, team or partner while at work. Your employer may have implemented new rotas or working patterns to assist with this. Face-to-face meetings should be kept to an absolute minimum. But when they cannot be avoided, only absolutely necessary participants should attend. Meetings should be held in spacious, well-ventilated rooms, or if safe and practical to do so, outdoors. In many workplaces, there are likely to be special measures in place to help with your social distancing. These might include one-way systems, zoning or separation markings on floors and walls, screens or barriers, and altered layouts. Make sure you're familiar with those in your workplace. If your work involves contact with visitors, customers, or contractors, be extra vigilant, as they might need support to help them understand the specific social distancing measures implemented in your workplace. Make sure you are aware of any limitations or special measures imposed on the management of visitors and customers, such as the maximum permitted at any one time. This will be detailed in your COVID-19 workplace risk assessment. If you handle the delivery or collection of goods at work, make sure you follow all COVID-19 specific measures implemented at your workplace. This might, for example, include revised pick-up and drop-off points, altered or additional procedures, and new signage or markings. Regular workplace cleaning is essential. Think about the objects and surfaces you touch whilst at work. Where possible, you should avoid sharing items like pens, tools, and electronic devices. All handheld items and larger shared equipment should be regularly cleaned with standard cleaning products. You should frequently wash your hands with soap and water for a minimum of 20 seconds. In toilets and washrooms, use electronic hand dryers where these are available. If paper towels are used, ensure you dispose of these in the bins provided. In common areas where there are frequently touched surfaces, such as door handles or lift buttons, you may find that additional hand sanitizer has been provided. Use it. Maintain good housekeeping at all times to help reduce the build-up of waste in your workplace. This is especially important if you work on shift and share your workspace with colleagues from other teams. There is some evidence that clothes can harbour the virus for several days, so you should wash these regularly. If you need to change out of your own clothes whilst at work, avoid crowding into a changing room, and be sure to store your clothing items securely. If your work involves the use of vehicles, you should ensure that you cleanse your hands before each use. The vehicles themselves should be cleaned frequently between uses. Pay particular attention to surfaces that are regularly touched, such as door handles, controls and keys. Vehicles should not be shared wherever possible. If you do need to share a vehicle with colleagues, you should keep to the smallest regular team possible. Your COVID-19 workplace risk assessment will describe the specific precautions you must take, which might include reduced occupancy of vehicles and separating passengers by leaving some empty seats. Personal protective equipment, PPE, protects the user against health and safety risks at work. If you already use PPE as part of your usual safe working practice, you should continue to do so. With regard to the specific risk posed by COVID-19, evidence suggests that wearing a face covering does not protect you, but in some circumstances it may protect others if you're infected but have not developed symptoms. Check with your manager or employer regarding the rules on face coverings in your workplace. If you have symptoms of COVID-19, the first thing you need to do is to get health advice. Search online for details of health services in your area. To protect others, if you or a member of your household show any signs of COVID-19, you should stay at home. This is called self-isolation. You must inform your employer as soon as possible. If you have to stay at home but feel well enough to work, ask your employer if you're able to work from home. If you can't work from home, use the online NHS service to get an isolation note. You can then send this to your employer as proof that you need to be off work. Make sure you keep up to date with the latest government advice on self-isolation, social distancing and testing. If at any time you become concerned about your condition or that of someone in your household, seek medical advice immediately. To summarise, stay vigilant for signs of the virus at home, work and in yourself. Familiarise yourself with your COVID-19 workplace risk assessment. Adhere to all social distancing measures whilst at work. Keep work teams fixed and as small as possible. Help visitors, customers and contractors to follow the rules. Clean your hands often and thoroughly, and keep your workplace clean and tidy. Keep vehicles clean and follow all additional precautions. Adhere to all relevant health and safety policies and procedures while at work. And stay safe.